Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
I'm Dr. Sanjay Jain. I'm a ENT specialist practicing in Delhi at Batra Hospital. So today we are going to discuss about vertigo. Vertigo in layman term means chakkar aana. So before talking about vertigo, let us first understand how the body maintains normal balance. So in very simple way, we understand that the body maintains normal balance by working in coordination with the brain and the peripheral organs. The peripheral organs which contribute to maintaining balance are the inner ear, the eyes, and the joints and muscles in the body. And the brain, the part of the brain which is mainly responsible for balance is the cerebellum. So there is a coordination between the peripheral and the central organ which helps in maintaining normal balance of the body. Since I am an ENT specialist, I will tell you more about the role of inner ear in maintaining balance. So in the inner ear, the part which maintains balance is called the vestibular apparatus. So normally the peripheral organs send signals to the brain interprets the signals, and a normal balance is maintained. So the vestibular apparatus, the role of vestibular apparatus is that it detects the movement of the head. So there are sensory receptors in the inner ear which detect movement of the head. And when there is a movement in the head, the vestibular apparatus sends signals to the brain, to the cerebellum, and then the cerebellum interprets the impulses and the signals, and then a balance is maintained. If there is any disturbance in the peripheral organs, mainly the inner ear, or some disturbance in the cerebellum, then imbalance occurs and we get vertigo. So the inner ear, there are three very common conditions which causes vertigo. The most common is the benign positional vertigo. BPV. In this condition, what happens is, just to simplify the things, normally the inner ear sends signals to the brain, and the signals or the impulses to the brain are normally equal from both the sides. And then the body maintains a balance. If there is any disturbance in the inner ear, then the impulses are disproportionate. The diseased ear will either send more impulses or less impulses compared to the normal ear. And because of the disproportionate impulses, the brain interprets it and then imbalance occurs. So the most common condition is the benign positional vertigo. Now what happens in benign positional vertigo is, in the vestibular apparatus, there are sensory receptors which are called otoliths. They are basically calcium crystals, and they act as receptors whenever there is a movement of the head. These receptors will sense the movement of the head and send impulses to the brain. They will send signals to the brain, to the cerebellum. So if there is disturbance in one ear, then the number of impulses from the diseased ear will be different than the impulses from the normal ear. And this disproportionate impulses causes vertigo. So what happens in benign positional vertigo is, these sensory receptors, they get dislodged from their normal position due to various reasons, most common being some head injury or some disease in the inner ear. So when the sensory receptors, they get dislodged from their normal position, then it causes disturbances in the impulses, and then vertigo occurs. So the patient comes to the doctor and complains that whenever patient moves his head, when the patient changes his position in bed, सोते वक्त जब भी करवट लेते हैं या सोए रहते हैं, जब बैठते हैं, सो के जब बैठते हैं, तो जब भी पोजीशन चेंज होती है हेड की, तो उनको चक्कर आता है, and that is called positional vertigo. That means the person gets vertigo with change in posture. So this is called benign positional vertigo. The diagnosis of this condition is mainly clinical. The patient comes to the doctor with these complaints. The doctor examines the patient and a diagnosis is made. The second condition is related to the inner ear, is the vestibular neuronitis or labyrinthitis. That means there is inflammation in the vestibular balance organ in the inner ear. There is some inflammation in the inner ear which causes vertigo. And the very common condition that happens, and this vestibular neuronitis, that means inflammation of the nerve which controls balance, or the inflammation of the organ that controls balance, that is called labyrinthitis. So the most common reason for this inflammation is related to the upper respiratory tract infection. So whenever we get a common cold or a upper respiratory tract infection, which may be either a viral infection or a bacterial infection. So this infection from the upper airway travels to the ear through the eustachian tube, and this causes disturbance in the inner ear. And usually the patient comes to the doctor and complains that the patient had a upper respiratory tract infection, following which he has started getting vertigo. So that is also a very common condition which we encounter very frequently. So in these cases, I will talk about the management later. So this is the second most common condition. And another condition which is called Meniere's disease. So in Meniere's disease, there is an imbalance in the fluid which is present in the balance organ in the inner ear. The fluid in the inner ear, which is called endolymph. So there is an imbalance in the quantity of fluid. There is overload of the fluid in the inner ear, and because of this fluid overload, there is vertigo. So these are the very common inner ear diseases which causes vertigo. So how do we diagnose these conditions? The benign positional vertigo, as I told you earlier, is mainly clinical diagnosis. The patient gives a history of getting vertigo with change in posture, which is very significant, and from there we examine the patient and a diagnosis can be made. Even the vestibular neuronitis or labyrinthitis, there the diagnosis is clinical. Meniere's disease also, there is a history of vertigo associated with hearing loss. There is always a hearing loss associated with vertigo and an abnormal noise in the ear, which is called tinnitus. So a triad of these symptoms, then we suspect then it can be Meniere's disease, and then further investigations are done. Then comes the central cause. So in central cause, the part of the brain which controls the balance is cerebellum. So if there is any disease in the cerebellum, there can be a tumor in the cerebellum, or multiple sclerosis is a very common condition which causes vertigo. So these are the common reasons why central vertigo can happen. So if there is central vertigo, then there will be other clinical features associated with vertigo. So the person will have vertigo. Along with vertigo, patient will also complain of severe headache, and then there will be other cranial nerve defects may also be there, which is not there in peripheral vertigo. So we can understand broadly is that the vertigo can be because of the peripheral cause, or it can be because of the central cause. Now, if it is a peripheral cause, the diagnosis is mainly clinical, with clinical examination and the clinical features, the signs and symptoms which the patients convey. The central cause has to be diagnosed with clinical examination coupled with radiological investigation in the form of MRIs and CT scans and all. So once we diagnose that it is a peripheral vertigo, then the benign positional vertigo, which I said is the most common cause of peripheral vertigo. So how do we treat this condition? So as the name suggests, it is called benign paroxysmal positional vertigo. Benign because it is not very dangerous. The good thing is that it is transient, it happens for some time, and then it improves also very quickly with treatment. So how do we manage this positional vertigo is basically the reason is the sensory receptors or the otoliths, they have been dislodged from their normal position. So what we do here is we do some head exercises to reposition the sensory receptors back to their normal position. And these head exercises, they are named as Apley's maneuver. So the ENT doctor has the expertise to do these exercises for the patient. And with these exercises, the otoliths are repositioned back to their normal position and the patient gets improvement in the vertigo. Besides this, some medications are also given to the patient, which also helps in improving the vertigo. Mainly antihistamines, and they help in improving the vertigo. In labyrinthitis or vestibular neuronitis, the common cause is the upper respiratory tract infection. We have to treat the underlying cause, treat the upper respiratory tract infection. And these upper respiratory tract infections, if they are bacterial, then they are treated with antibiotics. If they are viral, then the viral infections are mainly treated with anti-inflammatory medications. And of the common upper respiratory tract viruses, the EB virus and the herpes virus, they are very common reasons to cause this labyrinthitis. The Meniere's disease, the treatment is different. The Meniere's disease, we have to are usually treated with diuretics to reduce the fluid overload. Besides that, sometimes the surgical intervention is also required if disease, the vertigo is very severe. Otherwise, they are also treated with medications, mainly labyrinthine sedatives are given to improve the condition. So, what I want to convey is that this vertigo is a very common condition. Everybody experiences vertigo sometime. So, when we get vertigo, we should not be very scared. These are very treatable conditions and they can be treated most of the time. The treatment is very simple and very short. So we don't need to get scared of the vertigo. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.